underneath the police uniform. I'm just like you, a lover of laughter with dreams that grew. In every smile I share, a story unfolds. A reminder that compassion, it never grows old. Behind the badge, my heart beats the same. A melody of empathy, compassion, and fame with every act of kindness. I'm trying to be that change. Using my voice to break through the range. Underneath this uniform, I'm a human being with feelings and emotions. A story worth seeing through the triumphs and struggles. Spreading love, hope, and the power of love. But a soul with a purpose, seeking no fame. Underneath this police uniform, I am real. I'm a woman of strength with love. Nothing to keep behind in a secret. Just love to reveal. Because underneath this police uniform, I am human. A woman, not the norm. I may wear satin and lace and pearls underneath, but here to heal. Break the world's swirls. I fight the darkness to protect the weak. And in the line of duty, my compassion, it doesn't just peak, it lives and bleeds through the chaos. I find my grace. I think of being a warrior with love in every chase. The beneath part of being a police officer is that behind the badge, a heart beats strong, and I'm ready to mend what's been torn for so long, because with kindness as my weapon, I'll prevail. In the name of justice, I will lift the veils. I am love. I am truth, peace, freedom, and justice. As I repay my karmic debt, it shall be fulfilled, because I am the change. And my only aim is to heal and not kill. I want to heal and not kill. You see, I have a hard time explaining things sometimes, because most people don't see that power is an intoxication of indoctrination, causing frustration from all the emotional suffocation. And that's why my beloved is constantly telling me, you must stay balanced and stay centered. Because every tear I wipe, every soul I save in this uniform, I don't want to be a hero engraved in a tombstone. I am human with kindness as my weapon. I keep saying, I am human underneath this police uniform. Welcome back, everyone. It's Dr. Poetry with Def Poetry here with Floetic Justice behind the uniform. How you doing, Def?
I'm doing well. Thank you. Thank you. Welcome back. Welcome back. Happy Wednesday. We back for another episode 3, Floetic Justice. I know we're going to be talking about fibromyalgia today.
Yes,
we're going to be talking about fibromyalgia and the impact it has on women police officers, law enforcement as well. So can you tell me a little bit about that?
Absolutely. You know, fibromyalgia is a chronic condition. It's characterized by widespread muscular skeletal pain, fatigue, sleep disturbances, and cognitive issues, and is often referred to as a fibro fog. And if you guys hear me sometimes, I'm like, oh, I think I got a fog. I also suffer from fibromyalgia. It's affecting approximately 2 to 4% of the population globally. And fibromyalgia is significantly more prevalent among women than men. The disorder remains complex and is poorly understood, because not everybody understands the causes, right? They say the cause is still uncertain, but I believe it's a combination of genetic, environmental, and psychological factors. And, among the occupational groups, law enforcement officers, particularly the female officers, may face heightened risks for developing and exacerbating fibromyalgia symptoms. Right now, as we speak, I may have one. I start feeling kind of slow a little bit. It's like cognitive.
And these symptoms, due to the physical and psychological demands of the job, it gets a little worse for female police officers suffering with fibromyalgia, because we encounter unique stressors, right? Some of them are gender discrimination, work-life imbalance, exposure to traumatic events, even before we wore the uniform, and the need to consistently prove physical and emotional resilience in a male-dominated environment, and that's a fact. But
with fibromyalgia, right? Like, because I know from my understanding, it's something that it wasn't diagnosed. It was something that they couldn't diagnose for a while, for a long time. And then for yourself, I know a lot has to do with law enforcement. And you mentioned PTSD, post traumatic stress disorder. Do you feel like that you developed you developed it during law enforcement, or it was something that you've always had that just maybe got stronger and developed something more worsened it worsened later on in the years?
I don't want to say so much law enforcement, but I would say that it happened while I was working. They say the factors contribute to chronic stress. One of the known triggers for fibromyalgia is stress. And in both the mainland United States and Puerto Rico, female police officers work under high pressure conditions such as their male counterparts. We know that. Excuse me. It's often with limited institutional support for managing chronic health conditions like fibromyalgia. In Puerto Rico, additional stressors, right? We got more stuff going on. This is going to include economic instability, natural disasters such as Hurricane Maria. And I say Hurricane Maria because right after Hurricane Maria is when I was diagnosed. It was when I couldn't bear the pain. It's when stuff started really getting ugly for me. Right after that, I'm talking about, like, I actually thought it was that I hurt myself or something, but then I started noticing there was pain all over. Like, it was just on both sides. Like, if I usually have pain on my neck, right here on the side. This is one right here, like in here, and you can see sometimes I'm almost, it hurts, like someone's stabbing you, and it's on both sides.
Yeah, because it's always tense. Your muscles, yeah. It's neurological too, right? It's
correct, because it's sending the wrong messages. It's sending messages to tell me that I'm in pain, and it causes pain. Yeah. But I look great. I'm not trying to blow my own whistle here, but I'm just saying, I feel anybody looks at me, she looks healthy, but I'm in pain, especially when I have the fogs, right? But I wanted to say the natural disasters is a big issue being a law enforcement officer in the island of Borinque, and resource-constrained public health systems, okay? They don't really have that much information out here. We usually have to go see a rheumatologist, and to see a rheumatologist in Puerto Rico, you got to wait like 6 or 7 months just to see one. We don't have too many specialized physicians because they're constantly leaving due to the politics, and all the problems that we're having socially and economic on this island. They're all leaving, right? A lot of them. So the appointments are very difficult to get. And when you finally get an appointment, you schedule an appointment, there's a problem because they don't take your health insurance. So it's constantly, you're walking around with this fibromyalgia as a law enforcement officer, and you share this information to your superiors, and they're like, yeah, okay. But because there's so many myths about fibromyalgia, and there's been so many misdiagnoses, that it's almost like nobody really understands, and nobody really wants to take the time to understand, because obviously until it happens to you, that's when you're going to say, okay. But there's a lot of research, but we need more research, right? I was looking for some statistics, and there wasn't any. There's not reported. There's a culture, a code in the police department, especially females. We don't want to always complain because we're going to be looked at as the weaker, oh, they can't handle it. Right? So that's one of the biggest things. But I want to continue saying something really quick. Despite all the challenges, research on fibromyalgia within the specific occupational and gender group, like the police officers, it's limited. So we have to understand the intersection between fibromyalgia and the lived experiences of us female police officers in the United States and Puerto Rico, because that's critical, right? It not only highlights an under-recognized health issue, but it also raises important considerations, Dev, like for occupational health policies, workplace accommodations, and mental health support systems. Because as far as I'm concerned, we have psychology, we have psychologists in the police department, but you're usually there if you probably, if you use your handgun in an intervention, your firearm, excuse me, if you had a situation that you may have been, or you're showing that you're sad, you're sick, well, they take it away. But as far as fibromyalgia, there's nothing that you can go there and explain that to them, because they are overloaded with other situations. Right. They're not there to help the police officer who's struggling with fibromyalgia, because now you're feeling terrible working under those conditions. If you have all this pain, Dev, now you are a Marine. How heavy is the duty belt? How heavy is the bulletproof vest that we wear, the boots, right? And every time I turn around, they're adding another weapon on that belt. So with all that, I signed up to protect, and I'm for it, but I didn't realize that I was going to get something called fibromyalgia. In fact, I was in denial. I really believed it was just because I was working a lot of hours during Hurricane Maria. I was moving a lot of stuff. So, your back, you start feeling all these different, you feel sore. You feel like your muscles are aching all the time. It feels like you've been working out and you strained yourself, and then you start getting that pain. So you wonder, do I really have this? And I just felt that they were just busy diagnosing people just for the hell of it. Right. I'm one of those that I think that sometimes, no offense to the medical profession or anyone who works with the medical profession, but I sometimes think that they're just, giving out prescriptions and just get out of my way, take this pill and go. So I was like, no, that's not me. Up until I went to New York, and I was also diagnosed in New York 2 or 3 times. So I want to talk about that today. Okay. I want to spread into that. Yeah.
Do you know any females? Know any women in the police force now? Besides yourself? Yeah, besides yourself, that actually are use, or have you spoken with anybody as far as your peers, that women that are going through the same thing, or maybe?
No, I have not. They know, I tell them what I have, because they tell, one time I crashed a patrol car because I'm sensitive to the lights, the fluorescent lights and flashing lights. I'm really sensitive, and it was late at night, and I kind of went to back up, and I crashed the car because I couldn't really see. And one of the things that I had told my coworker, I said, I think I'm getting a fog, and I really can't see, but they see me so strong that they're like, no, it's all right. Don't worry about it. Just, we got this. I'll lower the lights, because sometimes the cars are tinted, right? And so that's when we had this big discussion on fibromyalgia, and I learned that a lot of people don't know what that is in the force. Now, I heard from another coworker who told me that she knows someone who has fibromyalgia, and it's quite debilitating for her, because they had her sitting down, right? She says she's this woman practically walks with a walker, so they have her on desk duty. I don't know who she is, but I heard about that. Then I have another coworker, a male coworker, who once he found out what it was, because I had a situation at work where it raises your blood pressure. When you're in a lot of pain, your blood pressure rises. I have to take medication for the blood pressure, because when I'm in pain, that affects my blood pressure. I normally do not have high blood pressure. I eat healthy. My cholesterol levels, everything is good. My blood, I'm Wonder Woman. It's right. The fibromyalgia, the inflammation, and all that stuff that starts happening. So I have been looking at diets and stuff. So when he heard that I have fibromyalgia, the first thing he said was like, oh Lord, I know that's painful. My wife has fibromyalgia. She's not an officer, but he was able to understand what I was going through, because he says he watches his wife suffer from that.
And
But it's often the quiet one. It's the silent pain. Because you look at me and you don't think I have anything, and I usually do a good job and hiding it, especially when I'm here. Hello, viewers, by the way. It's good to see you guys. It's those things where I put on my shades because the lights that are in front of me affect me. Like right here, so they bother me. So it's like I feel like I'm blinded. I usually have shades indoors, and a lot of people just look at me, Deb, like, well, look at her. She's trying to be fashionable. She's trying to be, what are you trying to be, a movie star? You look ridiculous. Like, no. Truly. And I didn't realize that. I didn't realize why I was always like, if I didn't have my shades right before I go outside, and it's like, where's my shades? Not that I'm hiding. It's just that I realized that bothers me so much that it'll give me an excruciating headache. Up until they told me that's part of your fibromyalgia, and especially the hearing.
Yeah, hearing sensitive. Your senses.
Oh my goodness, especially high-pitched voices. There's a coworker, right? She's a new police officer. She's new. I love her, but she has a squeaky voice, and she'll sound like, and I'm like, it's like piercing through me. Or that was an intervention I had like maybe 2 months ago, and it was out in the express. It was in the street, and all these motorcycles were passing through at the same time. There was like an ambulance and a fire truck and everything, all that. And I kid you not, Dev, I felt like I was going to get an anxiety attack because the noise was piercing through my ear. And I'm in there like, and the lady who I'm convening with, she's repeating what she's telling me. And I was trying to grasp it because she was speaking in Spanish. And I turned to my coworker and I said, what is she saying? What is she saying? I can't hear her. What is she saying? You're muted. I can't hear you. I have a piece on my fibromyalgia.
So it came into my life, disrupting the order, my order. Widespread pain, fatigue, moody, can't even get to sleep, amplified painful sensations, something about my brain and the spinal cord seems like it's having some painful signals. No processing, They say trauma, surgery, psychological stress causes this, but it's so painful. And I'm just wondering how that pain could cut like a twisted knife. There's no metaphor that can capture that. I feel. And I'm supposed to continue fighting on because, I'm Wonder Woman. Got a heart of steel. But this is like poison coursing through my veins, a hidden monster. And I get this feeling that it's trying to drive me insane. The agony is never ending. I mean, it makes me feel invisible, really. I'm not invisible, but the pain looks invisible. The pain is real. It's so real. And it's aching deep. And it's all that I could possibly feel. And all these noises, loud noises, they pierce like a dagger's blow in the sunlight. Oh, I love the sunlight, but it blinds me. It blinds me. The light hurts my eyes, and it's a painful show. And they say I'm blinded by stress, by my vision's a little blur, and this pain is like a dagger. It's so hard to endure. Fibromyalgia. It's a constant fight. It's called the invisible pain, and it's like a little thief in the night, you know? A thief in the night. A thief in the night. And the torture I face, it's like someone's killing me again and again and again. And every sound, a dagger right through my heart. I feel the pain in the vein, and it's hurtful. And it makes me sad, you know? I get down. 'Cause you gotta be Wonder Woman. It's like every sound, I keep saying it's like a dagger through my heart. And if someone's tearing my world apart, you're so evil. I'm Dr. Poetry.
I love that piece right there. I mean, wow. I got to give you a snap on that, but I mean, that was a powerful piece right there. Man, you broke it down. You broke it down right there.
Yeah, it's difficult to even listen to it. I changed the colors, if you notice, on the banner because it is Fibromyalgia Month. Fibromyalgia is it's Fibromyalgia Awareness is May 12th, but we're here celebrating today. Today is the 14th, so it's not more. It's just like it's not a celebration. I would say it's more like an awakening to promote awareness, much more research. You know, when I wrote that piece, Steph, I was in a huge flare up. We get flare ups, right? And I was trying to sleep and I couldn't. And anyone who knows me knows that when I'm not feeling well, I turn to poetry. So I start writing, I start singing if I want to, but I was in a lot of pain. I was actually laying down, and there was a dog barking outside, and it felt like the dog was in my ear barking. Everything from the car that's driving away, the muffler, anything, it just seems so amplified. And I was writing, and while I was writing, and then I started reciting it, and playing some music just to try to heal myself. I believe in that. I believe in trying mind over matter, trying not to think about it so much. But as I was trying to recite, I was forgetting what I was saying. So you hear me actually saying a little bit like, yes. And it's like, it sounds, but it works because that is
it really did
a concrete example of what fibromyalgia feels like. It feels like someone's stabbing you. It feels like you want to be, if you're like me, who always has to be moving. And I think in a lot of ways, that's what helps me moving, keep working. When I can't, I just stop. It's a lot. It's a lot. But you know what?
Good job on that poetic expression. And it's not that it's intolerable, because obviously you have to tolerate it, and it's just a buildup too, because I could just imagine the sirens, you constantly working, you got the sirens, you got the loud noises, you got the interruptions. Although you're sensitive to it, you're still dealing with it, so it creates more and more tension in your body that's just accumulating. So it's like you try to help yourself, you know what I mean, but then it's like you continuously have all that up and building up, and I'm sure it's tough. It's interesting. It's definitely interesting because from my perspective, I don't hear too much about fibromyalgia, and like you said, it's more common in women, because I've never came across anybody that's as a male that's actually came out or forward and said I have fibromyalgia. I have met a few women that also actually have dealt with it, so you know, even the first one that I've ever met, as far as them addressing it, their explanation right away was it's not diagnosed, but it's real, and they had to like almost like defend themselves right away, and it's something that you know it's it's unfortunate because who's to say what you're feeling or what's really going on, and who's to say that that's not a real thing or excluded from a condition, or just because somebody really can't see it or diagnose it properly. So that's a hard topic. That's tough. It's interesting.
It's diagnosed. It's diagnosed. The problem with the diagnosis is that they feel like you may not see it in a blood test, but it is diagnosed, because that's how we get diagnosed. We do get diagnosed. It's just that the way they measure it, the way they diagnose is controversial for some people, because of course some people are operating from a place that it could possibly be, misdiagnosed because it's so close to other situations. So
Okay.
it's the process of elimination, like rheumatoid arthritis, right? Chronic fatigue, pain, or whatever, those different things. But there's some pressure points, and don't take it from me. I have a video that I would love to share that gives us a brief of what's going on with the fibromyalgia. There's actually now some research. It's not on this video, but I saw this boulder where they actually do an MRI and they look at your brain waves. I mean, last week I went to the hospital because I was not feeling well. My neck, I had a whole flare up, right? When I went there, the triage checked my blood pressure. It was sky high. It was like almost 180. Over 104, 115 or something. Like, it was really to the point that they had to wheel me into a stretcher. And they were like, oh my God, you suffer from high blood pressure? And I say, I have high blood pressure because I'm in severe pain. So when I said that, they didn't give me any high blood pressure medication. You know what they did? They gave me an anti-inflammatory injection, right? To bring down the pain. The minute they did that, my blood pressure dropped completely, super low. And that is a clear example of, it's not blood pressure because I'm because I'm my fatty liver, or no, I eat very well. I'm very healthy. It's the pain that I deal with. Some of us have a high tolerance for pain. So this one goes out to all the female officers who are suffering from fibromyalgia and is wearing a bulletproof vest, a belt, in and out of a police car with flashing lights that we all know makes it worse for us. The noise, the stresses. And when we get home, we take that off and we throw it's like you can't even get out of bed. And then we do it all over again the next day. Because when we signed up for the job, we were not thinking fibromyalgia, right? And we're going to get into it. Let's see. Where can I do this? Here we go. Shout out to all the listeners. I am and viewers. I love to play these little videos that we can explain. They could explain it in a much better way. All right? Here we go. Yeah.
Fibromyalgia is a chronic condition characterized by widespread pain and hypersensitivity to pressure. The name comes from fibra, which means fiber in Greek for fibrous tissue, myo referring to muscle, and algia to pain. It is estimated that up to 8% of the population is affected. However, the majority of these are not diagnosed. Females are twice as likely to have the condition as males, and it is diagnosed most commonly between the ages of 35 and 45, although it can be diagnosed at any age. The primary symptoms include chronic widespread pain, increased pain in response to tactile pressure, called allodynia, fatigue, cognitive impairment or brain fog, and sleep disturbance. There are several other possible symptoms too, including anxiety and depression, muscle spasms, pins and needles known as paresthesia, nausea, and dysmenorrhea in females. Weight gain and cold sensitivity are also possible. Conditions like irritable bowel syndrome, temporomandibular joint disorder, and chronic fatigue syndrome seem to have a link with fibromyalgia. Therefore, jaw pain and gastrointestinal symptoms can also be present. The cause for fibromyalgia is not currently known. Some hypotheses include central sensitization, where it's believed that these patients have more sensitive detection of pain, leading to a lower threshold for pain. It is thought that there is hyperexcitation of pain-sensing neurons and underactivity of the inhibitory pathways for pain. Often, there is an emotional or physical stress that acts as a triggering factor, and as we said, fibromyalgia is linked with conditions that have a stress component, like irritable bowel syndrome, temporomandibular joint disorder, and chronic fatigue syndrome. As well as a manifestation, sleep disturbance appears to be another risk factor, as are smoking, obesity, and sedentary lifestyles. There is no specific test used to diagnose fibromyalgia, and in the majority of cases, tests that are done come back as normal. In 1990, the American College of Rheumatology produced criteria based on tender points to diagnose fibromyalgia. In total, there were 18 points, and the pain needed to be widespread, affecting all 4 quadrants of the body, as well as being persistent for more than 3 months. In 2010, these were revised. This included a widespread pain index based on which areas of the body had been affected in the last 2 weeks, giving 1 point for each affected area, giving a range between 0 and 19 points, and then the symptom severity score, meaning the severity of fatigue, waking up unrefreshed, cognition, and the general somatic symptoms, each scoring between 0 and 3 points, making a total of 0 to 12. Overall, the criteria was a widespread pain index of 7 or greater and symptom severity score of 5 or more, or widespread pain index of 3 to 6, but with a symptom severity of 9 or greater. The symptoms had to have been present for more than 3 months, and no other condition could be present to explain the symptoms. Some studies suggest that 66% of people diagnosed with fibromyalgia may have other medical conditions instead. Examples include lupus, non-celiac gluten sensitivity, polymyalgia rheumatica, hypothyroidism, and nerve compression syndromes like carpal tunnel syndrome, to name a few. It is thought that 4 subtypes of fibromyalgia exist, and these are an extreme sensitivity to pain without any psychiatric condition associated, fibromyalgia with pain-related depression, depression with concomitant fibromyalgia syndrome, and fibromyalgia due to somatization, meaning displaying psychological distress in the form of physical symptoms. There is some controversy with fibromyalgia. The International Classification of Diseases, or ICD-10, lists fibromyalgia as a disease entity alone and advises it should be classified as a functional somatic syndrome, meaning a chronic disease with no identifiable cause rather than a mental disorder. However, the preliminary ICD-11 has characterized fibromyalgia as a chronic, widespread pain. Many question whether or not it is a disease entity at all. Due to the unexplained nature of fibromyalgia, there is no cure or specific treatment, and management is usually targeted at symptom management. Non-pharmacological therapies are used alongside medication, with exercise being the most effective, boasting significant evidence that suggests it can reduce the symptoms of pain and fatigue. Aerobic exercise is mostly recommended, but therapies such as yoga can also help. Cognitive behavioral therapy has been shown to have a small beneficial effect on reducing pain, and measures should also be taken to reduce stress levels that may be the trigger. Good sleep hygiene is also recommended, which includes setting a routine, avoiding caffeine and large meals before bed, not using screens in the hour before bed, and making sure the room is dark and comfortable. As for medications, the US Food and Drug Administration has approved 3 main drugs for fibromyalgia. These include the serotonin and noradrenaline reuptake inhibitor antidepressants, duloxetine and milnacipran, and pregabalin, which is a form of anticonvulsant medication. The tricyclic antidepressant amitriptyline is also often used. Opioid use is controversial and not currently approved by the FDA for fibromyalgia. Over-the-counter medication like paracetamol and non-steroidal anti-inflammatories have not been shown to be effective in fibromyalgia itself, but are useful in reducing the pain triggers of fibromyalgia.
Interesting. Very interesting. I think you're still muted. So
yeah, it is interesting because I take duloxetine, and I like the fact that opioids is something that we're not. I'm glad that they're not even giving that. I don't want any of that. Even I'm sensitive to any type of medication in terms of making me sleepy or anything like that. I do not take that when I'm at work. I try not to take it because I don't want to be on meds. So what I do practice is sometimes meditating, stretching. I love the yoga. I took a nice yoga. There's a nice spot over here in San Juan, and but I haven't done that in so long because I am very busy. I do believe, I know this for a fact, that staying moving helps a lot. The problem is that you got to keep moving, but you can't do anything strenuous, like hard impact. Like if I want to run on a concrete, it's not recommended. On the pavement, like jogging. You were saying?
That's interesting. Like as far as exercising, I know it's beneficial as far as working out. It's actually recommended to do powerlifting.
They recommend it, but when you're doing it, it's very painful. Because if I'm sensitive to pain, when my muscles are sore, I'm going to feel it to the 10th power. So none of that makes sense to me sometimes. Like the other day, I did a couple of with a dumbbell. Remember, I was doing some exercises with that and I was fine. Yet 2 days later, I was in severe pain in my neck. So it means that I have to keep going. I have to do exercise like every day. I'm not sure if that's, but I know that when I put on my bulletproof vest and I put on my belt, now I'm walking around with all this pain. When I'm going in and out of a patrol car, I'm going, it's painful. It's painful. So it's like, you sound like you're complaining. You sound like a nag. I don't want to sound like that. So it's one of those things, especially you consider yourself a person that's very resilient, very strong, to work around it. What does help me is stretching. What helps me stretch. I was a dancer. I was always athletic. I could run. My biggest thing to go to lose weight or to stay in shape was running. I was just thinking about maybe getting one of those workout bikes or something like that, to continue moving. When I'm working in the patrol car, I get in and out of it. And if I'm sitting for too long, I'm already like, can we stop the car? Can I walk around? And I work in the beach unit. So I'll walk around the sand and, look at the sky, look at the water, anything that's relaxing. If I have a few minutes where we're not called on any type of intervention calls or anything like that, I take advantage of those moments and I chill. I relax. Like I truly try to relax because it is triggered by stress. I could tell. I go through it.
So they said at 4 different types of fibromyalgia. Is that what it was saying? As far as
yes,
because you said you were pain. Is that the only category you think you fall under, or
I fall in? Yeah, I fall in because I don't feel like I have any depression. I don't feel like that. I'm not depressed. I feel like I'm not the type to sit and not want to do anything. I'm a fighter. I'll get up and I'm like, let's go. Let me see what I can do today. I'm not depressed. Depressed people don't take the time. You know, I do a lot for not. I don't feel like that's what's happening to me. I think it's strictly pain. It's pain, and given my personal experience with all the surgeries I've had, what it fails to mention is that one of the theories about fibromyalgia is if you've been through a trauma, physical trauma, or mental, emotional trauma, right? I think I've had both. I know I have both. I don't know why I keep saying I think. I have both. I've had some emotional trauma, and I've also had some physical trauma. How many surgeries I've had, you know, I've been through a whole lot. Yet it shows up later on in life, right? Because your body is used to being in trauma, is used to going through something. It's like you got to go. So the nervous system is telling you, you have pain, you got to go. It's almost that fight or flight thing, almost too, you know. But some people have anxiety issues. Some people have depression. And as a company, it seems to be amplified or aggravated with fibromyalgia, right? That's what I've been reading. But everybody seems to have their own, these specialists, these doctors with PhDs. They have a lot of different things being said. And I think I know for a fact I fall in the first one. I wouldn't be still in office. So in fact, I pick up on my mood. Like when I know that I'm like feeling down, I'm like, oh God, this pain. And then I'm like, hey, how you doing? Because I'm a big smiler. Like I smiler. Like that's a word. I smile a lot. So I believe that even if I'm not feeling good, I'm going to give you a smile, you know, that type of thing.
I can see how stress also adds, you know, to the equation as well. Like you know, your body, you just stressing, it tenses your muscles and tenses your whole body, and it accumulates, it builds up. Um, you know, and it could demobilize individuals as well. Um, you know, just from the tighten and tense, you know, your body and your muscles just tensing up. So that's tough. It's interesting. It's very interesting.
Yeah. Yeah, it is. It is. I know you had you wanted to mention the psychological factors or something like that. You wanted to get into that?
Yeah, you know what? I did look up some psychological factors, and as far as for women um in the police force, right? So let me see if I can pull this up also. Um so the psychological factors linked to fibromyalgia in police women, right? One we already talked about is that chronic stress. Long-term exposure to stress may alter the cortisol levels and increase vulnerability to chronic pain conditions, such as fibromyalgia, right? Uh, High vigilance requiring policing contributes to constant psychological arousal. So your brain is constantly, you know, heightened, lowered, heightened, lowered. It's like a roller coaster, which can lead to fatigue and pain syndromes too. Post-traumatic stress disorder, which you was talking about as well. You may experience or witness violence that contributes to your already PTSD. A known risk factor for, you know, that's, you know, it's you constantly seeing stuff, being exposed, it heightens your stress levels, your PTSD, and the risk for you know, the effects of fibromyalgia. Depression, anxiety, not just for yourself, but for, you know, anyone else. And you have mentioned also anxiety. You know, they can both result and contribute to the pain. All of this is almost bringing it back to like your body being tense.
Right.
For everything I'm reading, is your body being tense. Your muscle. It's not your muscles. You just tightening your muscles. It's your brain and your body. Just it's like your jaws clenched. You know, so long. It's gonna hurt. You know, your muscles is tense. Yeah, you're gonna be in pain, right? So
It's a
you know,
lot.
it
It's a
is.
lot.
health struggles for yourself, for female police officers? It's an issue because it's underreported, and it's due to the stigma. Like you were saying, mentioning earlier, not too many people bring it up. Nobody wants to talk about it, and they don't want to complain. You know, um, Poor sleep due to your shift, and trauma-related insomnias. They can work.
I mean, and we're speaking of police officers who have been on the force
Right.
without any fibromyalgia, because when you obviously go into the police force, you get a physical, complete physical. We're not speaking of people who joined the police while having fibromyalgia. This is something, if you notice the ages, you could even get that at the age of 45 or 50 plus. It's not something that everybody could understand. Police officers with fibromyalgia, they're facing a unique and challenging, I'm telling you, situation. Because it's not easy to balance physical and emotional demanding positions. Now, it could be a police officer, it could be a firewoman, it could be someone in the military, right, with chronic pain conditions. So they tell us the first thing that the doctors tell you, Def, is to reduce the stress. They say reducing stress is crucial to managing fibromyalgia symptoms effectively. But how do you reduce your stress if you are a first responder?
Right.
So one of the first things they talk about is workplace accommodations, modified duty, requesting light duty assignments that reduce physical strain, things like administrative roles, investigations, and training. That's the type of light work that they would recommend for you to have to alleviate the stressful part of the operational side of law enforcement.
Okay.
They talk about flexible scheduling, right? Advocating for a consistent shift, because that's another thing. If you work from, for instance, 12 p.m. to 8 p.m., that's the shift. And then someone on the 4 a.m. to 12 p.m. shift reported sick, and they need to put you back on there. They need to put you on that shift. Now you're changing, but guess what? You're on meds, because how do you manage? You have to change everything around, and that does not affect that. That aggravates the fibromyalgia, okay? Because it's gonna give you a flare up. What's a flare up? A flare up is when everything is fine, then all of a sudden something, whether it was stress, it just comes in out of nowhere, and you start getting all these huge painful things. It can happen in the middle of you just crossing the street. It can happen while you're eating. I mentioned this not so long ago, Def. When I was in Europe, I went over to Rome for my nephew's wedding, and I was in the airport having something to eat before I take my flight. I think this was in Rome. I was going to transfer over in Spain. And when I actually went to get up to get ready to go for my flight, I couldn't walk. They had to grab me and get me a wheelchair. My legs, I couldn't feel anything. The pain, the only thing I could feel was pain all over my legs. I could not walk. I've seen certain people who end up using walkers. I said to myself, there's no way I'm going to be that way. I'm going to keep moving. So it's mind over matter. You don't want to, no matter how operational you are, no matter how enthusiastic you are about being out there working, if you are feeling constant debilitating effects with your fibromyalgia, I strongly suggest to request flexible scheduling and modified duty, right?
Now with that, do you feel like there's there's sufficient amount of resources, like health resources for y'all, like, because there is pressure from, like, do you feel like there's pressure from your supervisors or lack of support from peers? And also, like, going into like the health, the resources, do you feel like this available for you to actually, take advantage of alongside of having your responsibility at work?
Well, for the sake of resources, there, like I said earlier, there is a psychologist, but his job is not only just to, he's not there. He's to make sure that we are psychologically prepared, or we are safe to carry weapons, right? I think that every time you go to the psychologist, they don't say that. They try to promote and advocate that we all go for whatever issues we're going through. Bear with me one second. Just they want us to go and help out, and help ourselves by speaking to the psychologist that's there. But this psychologist is overworked. Let's talk about it. We have like 1 or 2 psychologists in the police department. He's there because if you had a situation with a coworker, they disarmed you, and now they're going to evaluate you to see if you're mentally all right to carry a firearm. You're not there to talk about, I have fibromyalgia, no one's helping me. They say to do that, but when you go, it's really nothing else to do. It looks great saying that we have an office, but when it comes down to the reality, everyone's overworked and there's no time to have a conversation. There's no space for anybody to go there and talk about what we really need is someone to provide stress management techniques, helping us breathe, mindfulness, breathing exercises, give us some, they say journaling. I'm a poet. I write poetry. This is what I do. I cope with my fibromyalgia by being here, helping others, staying constructive, staying in an uplifting energy, Not everyone's there though. Those are the ones we're speaking about. We're speaking about the ones who, let's just say, have psychological issues. That type of fibromyalgia, that they already may have some anxiety. They may already have psychological situations, emotional traumas, right? But then we have the one that just has pain and they just getting pain, and how they deal with that. There is no set for everyone because everyone's is different, is what I'm saying.
So as far as you mentioned psychological, the psychological factor, do you feel like, because you feel like you don't at this point, but like, at some point, do you think, or did it start psychologically? Because, you have to.
No, it didn't start psychological. It started with pain. Like there was no psychological psychosis or anything. What it was is it feels painful. You just have pain. You have headaches. You think that at one point I thought I was having a heart attack. I remember, I'll never forget. But see, at this time I wasn't diagnosed yet. I kept on calling it something else because I don't know what fibromyalgia was. I don't know what that is. In fact, I would hear about it, the commercials, I would see certain things and I'm like, they always trying to. I'm one of them people that I think that the pharmaceutical companies is just another mode of production and they're trying to sell us these things. I'm one of them people. So I don't really believe in that everything is really existing. I'm a naysayer when I first heard about fibromyalgia up until I felt it. Okay. And what the first thing you feel is pain. I cannot speak for everyone else, but you asked me if I felt that the psychological stuff came first. No, not for me.
Well, okay, so not so much that it could have affected you first, but like the psychological process, like you have to, as far as you feeling the pain, what did that do for you psychologically? You felt the pain first, but
the only thing that it's doing for psychologically is that I'm working in an agency and I'm afraid to affect my coworker because I may be in stress, in pain like I did when I crashed the car. Psychologically, I'm concerned that I may put somebody at risk. That way, if I got to run after a person, so it's more and more preoccupied of concern.
Okay.
But it's not that I'm like, I can't handle it because I've been handling this fibromyalgia and I've been speaking on it now. But anybody who knows me for years knows that they can't even believe I have it because the way I handle it psychologically. You see what I'm saying? What's affecting me is the concern that I have for many, many others. Like I always tell my coworkers, guys, or females or whoever, today I'm having a flare up. All right. So if we're gonna intervene, let's be wise. And it's one of those things that we talk, you know, not, or I'll just say, I'm gonna need to go home. It's time for me to go home. I can't do this if it's really bad, because I'm not gonna not only put them in danger, but I'm not gonna put myself in danger, and I'm not gonna put anybody else in danger. Right. I've been evaluated. I'm on meds. This is a medication. This is the duloxetine, and this is the losartan for the high blood pressure when the pain is so high. Want to make sure that I don't go into a stroke. But it's hard. Not everyone has a psychological situation going on. They can't handle it. They're not built for it. They've had other things going on with themselves. You know what I mean? Yeah. I've talked about in my poem Unborn. I'm a woman who lost the ability to have children. I went to therapy. I managed it. You know, the ones that go to get help and talk about, I've done the therapy, I've done all that, and I look at life like everything is a lesson. In fact, I call fibromyalgia the Wonder Woman syndrome. I call it that because, well, I don't lift weights, but I feel like my muscles are tight. Yeah. I hear things clearer, like more than most people. Like it's like bionics. Like I'm hearing things louder. Like if the dog is down the block, I'm hearing him bark over here. That's a true. This is real, right? Smells. So sensitive. I could immediately smell things from a mile away. And that's a truth. I think we should conduct a study on fibromyalgia patients. Well, you know, maybe, I don't know. And then those with the eyesight, I could see things, but the light seems so sensitive to the light. It's kind of strange, you know. But I'm not so sensitive. The sun is great, but the light, when it comes to fluorescent lights, or if you go to Walmart, you know, they have like those lights up there. Those are the ones that really bother me the most. Like I gotta, like the light that's in front of me, the ring, like it'll bother me a little bit. But in terms of psychological effects, the only thing is, and that's with anyone who wants to work, who's used to being, like for instance, an athlete. You're used to being an athlete, and then all of a sudden you get something that you are not going to be able to play the sport anymore. Well, what's the psychological behind that? What's going to happen? You're not going to get emotionally disturbed, but you're going to get sad for a minute, aren't you? You got to get used to not playing ball because you got hurt. I have to get used to knowing that I may not always be in the street. I may have to start taking a desk. That's okay. The world's not going to come to an end for me. But not everybody is going to deal with that way. That's where I'm at with it. That's where I'm at with it.
Yeah, it does something to individuals.
It's not, I'm not gonna, you know, come on. We just celebrated Mother's Day. I didn't kill myself. I can't have children. I'm not crazy. Do you see what I'm saying? Like these are things, life continues. I feel like if I've overcome so many things, you think I'm not gonna I deal with fibromyalgia like it's nothing, but I think it's important for the police departments to start doing some research and start providing, if they haven't already. I speak of the police department that I work for. There has to be something, there has to be much more research. Because when I went to look at the statistics in the United States Department of Labor to see who actually, if there's statistics on anyone period, who's working and needed some help because of fibromyalgia, there aren't any statistics. They just have statistics on the disabilities, but there's nothing specific. When I went to look at the statistics of the Puerto Rico State Police Department to see what is it, you know, is there any problems with fibromyalgia, there's nothing reported. If not all the crimes are reported in the Uniform Crime Report, what makes us think that there's going to be people reporting that there's fibromyalgia within the police force?
Yeah, not everybody's it's like the census.
Right, because it's not asthma.
Participating in the census.
It's not diabetes.
Yeah.
Right? It's not cancer. But fibromyalgia is very painful. And so when I think of that, it's almost like, why is it that we're not, because giving you medication is only treating the symptoms, it's not making it go away. So what do? They say that eating healthy, grounding. You know what works for me too? Grounding. When I take my shoes off and I walk through I hug a tree. I hug trees. I'll be like, and it's like, I feel like the energy, you know, but yeah, there's psychological factors, but there's a lot of people who come in with already psychological situations already, like a stressful situation. Somebody got divorced, somebody lost a child, you know, that could be a trigger. But
Depression
stress,
factor, you know, they probably, yeah,
you're chopping up a little bit. I don't know if it's just like
then
popping. Yeah.
they probably go into a depression factor, which makes it worse for them.
They probably were already depressed. Is what we're saying, that some people come in depressed already. They were already depressed. And so depression makes you feel like somatic, like you start having pain that you don't have, but it's because you're depressed. There's a lot of people walking around who are so depressed and they feel like they have pain and stuff like that. So I want to be responsible in this conversation about fibromyalgia, because not everybody with fibromyalgia has it with a psychological situation, because that's the problem we're having. We're trying to link it and make it a mental health issue, when in reality, it's not only mental health. And that's the problem, because that sounds like it's all in your head.
Okay.
So I'm very careful when I hear people say the psychological situation, and they're trying to link it like with a mental health problem, like it's in our minds.
Not so much a link, it's just more of
it's correlated with that. It's correlated. There's a lot of research on that, and that's why, especially in the police departments, women all the time, if you say something, es una loca, or esto tiene eso. This is why I don't play when it comes to fibromyalgia. I'm very careful who I speak to about it, because the first thing they want to say is like, that's psychological.
Right.
And that it is not psychological, because what we're the underlying statement that's not being said is it's almost like saying your psychological ramifications are explaining it all. Like, it's a psychological situation all the time. Meanwhile, you know, if so the noises that bother us is in our mind. The strong odors like perfume, cleaning agents, smoke, that may cause nausea for us, or headaches, that's in our mind. Because fibromyalgia patients usually report that they have a heightened sensory to detect smells that others don't notice. That's why I call it the Wonder Woman. We hear louder, like before something comes, we hear it. I mean, I'm not kidding.
I mean,
it's almost like,
I see what you're saying. Yeah. Not an argument, you know, but you asked, is it in our mind? You know, like
that. What
you asked, is it in your mind though?
No, that was hypothetical. I didn't ask for you to answer. I'm saying, I mean, really, is it in our minds? Like, that's the hypothetical question.
Okay.
Like, we know it's not in our minds. That's not in our minds. It's not. The whole purpose of this show is to highlight something that people always end up saying, that it's all in your mind.
Yeah.
And that's why I'm telling you, it is not. That's why I showed the video. The video clearly states it is not in our minds.
I don't think it's all in just all in anyone's mind. I'm not singling that out, for just so you know.
No, I'm not saying that you are.
Yeah.
What I'm saying is that this is a situation. This is the reason why we're being ignored, because they keep going to psychological stuff. They focus on that part. They don't focus on what about the pain the person's feeling. But there's psychological factors. That's the first thing people want to talk about.
Right.
When in reality, what about stress management?
Yeah, or pain management. Yeah.
Because the first symptoms is what? Pain.
Yeah.
Yeah, we want to know why you got the pain, because there's something psychologically wrong with you.
Okay.
That's why we have to be very careful. Just like when it comes to people who are depressed. When people are depressed, what do? There's a lot of cutters out there. This is not the same thing. In fact, there is a video that talks about, fibromyalgia being a lot of people. Well, I wouldn't say a lot of people, but they mention how there's so much information regarding having numerous surgeries. There's a correlation with individuals who've had a lot of traumatic surgeries, who end up with fibromyalgia. Ask me how many surgeries I've had in my stomach. Ask me.
Right. I mean, tell us.
I was
I'd like
hoping
to
you
know.
would ask me. Follow me. Ask me how many surgeries I've had. Just ask me.
How many surgeries have you had?
I've had 15. 15. Not little ones.
Wow.
Scars that are this long and this long. 15 in my stomach. I'll never forget the pain I had in 2011 when I came out of recovery, when they were giving me a transfusion. The pain that I felt while they were giving me a transfusion. I could still hear my mother screaming, saying, "That's my daughter. Let me in. Let me in." She had just got off a flight because she heard me screaming. And when I grabbed the nurse and I said, "Nurse, I need something for the pain. Something's wrong with me. I can't." And I didn't even know what was going on. Hell, I thought I didn't even know I was alive. It was all weird to me. And she said, "Sweetheart, we already gave you pain. We gave you morphine. We gave you," and you know what? That felt like they were hurting my whole spine. So if I had surgeries like that 15 times,
oh yeah,
what makes anybody think that this is psychological when this is clearly because I've been through physical trauma? Now, growing up in the South Bronx,
right,
and in my home, there was trauma too, emotional trauma. But that didn't affect me up until we having this conversation. And I say affect meaning like, yeah, but we still made it to school, still went to college, still did everything I had to do, still good. Not losing my like I say, losing the uterus. These are really strong things that one goes through. These are all losses, things that happen. But I became a police officer. I got my master's. I still did what I had to do. So it's almost like the world is, you know what? We're still going to give you some pain. You're going to get fibromyalgia now. Let's see how strong she is. And you know what I do? I still get up every morning. Sometimes I can't go to work because I don't feel good. But most of the time, I'm right there front and center. Anyone with a psychological situation would not make it to work. They probably would have killed themselves a long time ago. Not everyone's built for this. That's why I call it the Wonder Woman syndrome. So it's very important that when we analyze these things, because there's someone out there right now who's wearing a uniform who has fibromyalgia and is quiet because people make her feel that she's crazy, or she's just a hypochondriac, or she's just lazy. Because one of the biggest symptoms is fatigue. You get up and you just want to lay down again. You get up and you're gonna get, you know what I love about it is that I fight it. I'm a fighter. I'm like, you know what? I feel tired, but I'm gonna get up. I feel so lazy. And then I feel that, lately, sometimes I used to be the type to have my everything organized. I'm a organized freak. I think I have OCD. But lately, I don't care about it. I'm like, you know what? It's gonna be okay. Because if that's gonna cause me stress, then I'll do it later. Yeah. And you know what I mean? And that's my way of saying that's one less one less stress for me not to have any type of triggers for this fibromyalgia that could be challenging. Now I have good days. There's days that I have great days, and then there's days that I'm like, oh my God, I sound like my poem, What do you think we should do? Any ideas in terms of stress management aside from mindfulness and breathing exercise? And they have a lot of meditation apps and journaling, but how else do you think we can
I mean, honestly, we did mention, we talked about exercising. We spoke on exercise. Right.
Yeah, I like physical care, like the stretching and gentle movement. Eating anti-inflammatory foods and staying hydrated is a must. It reduces those symptoms. Absolutely.
Like, I mean, yeah, as far as exercising, you mentioned exercising, and I think I guess it would be different for each individual. You know what I mean? Like, whatever works for them. But definitely staying busy and fighting with yourself, like you said. If you feeling that, you don't want to get up because
Be
that,
kind to yourself. Be
yeah,
kind to yourself. Be kind to yourself. Fight the need to embrace it so much. You know
yeah,
what I mean? I'm not marrying fibromyalgia. Like, I feel like in my mind, I have it. Yeah, this is what's happening, but this is not going to take over me. Like, I have plans in the future to be that elderly lady on the beach doing yoga. I have plans on still looking beautiful during the future. I'm not going to allow this to. I've seen people like literally walking and using a walker, super overweight because they allowed the fibromyalgia to get to them. I cannot speak for everyone. I speak for me. Awareness,
and
learn, get better. I have an appointment soon. I'm going to go see a rheumatologist to see where we at with this. If I need physical therapy, give it to me. I'm thinking about losing some more weight. Maybe I need to lose weight. Definitely watch what I eat. Anti-inflammatory foods, that's a must, because this is a lot of inflammation that sometimes comes through. Physical therapy and all that greatness. And yes. For those moments where you're at work and people who do not understand fibromyalgia, who I call it, they shoot from the holster without even understanding or studying. Those are the folks that may bother mentally. You might be worried about how they view you. You're worried about your image. So there goes the psychological stuff. There's counseling, therapy, peer support groups. There's even trauma therapy, for people who have PTSD or traumatic events. Just take care of that. And I'm going to say this with my heart in my hand, with all the love I have for and respect for the high officials in any police bureau, for all female police officers out there. I encourage you to set clear limits. This is about boundaries and self-advocacy. Do not take on excessive overtime or high-risk assignments. Avoid it. Because if you're suffering from this, you know what this is like. You're not only putting yourself at risk, but you're putting the people you're working with at risk. I've learned to talk to my super, and they may not believe me. At this point, it's not about what they believe or they don't believe. This is about my life and the life of the people in the street and the folks that I'm near. I'm quick to be like, I cannot drive, or today I took my medication. That's it. Because if the police department where you're at and the medical doctor that reviewed you knows what you're on it, there's all in writing, why would you put yourself? Because now you're being neglectful. And you will go in. You see that? It's important. It's super important.
interesting.
I don't understand why folks don't get that part. You got to communicate with your supervisors. You got to educate them about fibromyalgia. It's unpredictable. It's unpredictable. It's unpredictable. I could be fine, and all of a sudden I go running and I could collapse on the floor. I said this. You should request reasonable accommodations. I've already did that. There's something called ADA. Okay. Know your rights. Understand workplace protections for chronic conditions. And sleep hygiene. Huge. Huge. I've been doing this. I kind of want to turn off the lights and I light a candle because I'm big on leaving the TV on. And I'm learning that when I turn the TV off and just go to sleep, it's helping. It's not easy. We're in this industry, right? We always doing a show. We always doing poetry. We doing a lot of running around. And I love to watch the TV, see the shows and see what's going on. Or we could do this better, production, this, that, Def, we should do this. I'm one of them people. I'm always everywhere. But I also know that I got to turn it off. So I got to take my own advice, y'all. Seriously. Yeah. Well, I think you definitely need to consult with the department medical staff. And yeah, I think magnesium, absolutely. Magnesium, vitamin D, turmeric. turmeric is really good. I use that. That helps me a lot with the inflammation and the fatigue. Heating pads, a warm bath, that helps relax the muscles right after our shifts, right? These are good things to think about. Just be mindful of it. And if you need a job reassignment, go for it. In some cases, transitioning to a civilian role in law enforcement is not the best. Transitioning to a civilian role in law enforcement may be the best long-term position. I don't know. I may do that. I may have to do that. I'm going to think about that. I'm going to have to ask my supervisor, how do I transfer over to a civilian role? Because I'm thinking about it, yeah. I'm seriously thinking about it. I have no need to prove anything to anybody. My 18 years of law enforcement, I know exactly what I give. But I think we have to be responsible. You know what you feel. You know what you go through every day. I would never want anything to happen to anyone because I was unable to react. Our jobs are very important. Super important. Not to say that everybody else who's not a police officer doesn't have an important job, but when it comes to our physical and mental and emotional health, if we're not right, the streets are not right. And if the streets are not right, none of us are right. So we got to get it right.
I'm frozen to the bone. That's what the psych says. He says my heaviness and darkness is in my soul. He says I'm cold, but he's wrong. I am a soul. So this one's for the ones who've been on that mode of fight or flight, trying to remain alive, living on survival mode. It's a feeling and it'll go away, but it's an addiction to living a life we don't love, preferring to do it all alone, smiling and smiling all along, singing to the wrong song. But today, it's a new day, and we control our fate. This one's for the fighter on fight or flight mode. When you're wondering how to regulate your highs and your lows, we are living in constant state of stress, conditioned to the rush of the arousal, conditioned to addiction, to the emotion, not being able to control the outcome, because we can't predict our future outcome, but we on threat or danger in this outer and inner world we can't see. We're living with TDC, threat, duress, and coercion. We feel the suffocation, so some of us, we turn to meditation, avoiding that detrimental medication. It's like we feel this overwhelming lack of patience. We do realize they want us to be the perfect patient. It's our brain and body not in homeostasis. This one is for the ones who've been on that mode of fight or flight, trying to remain alive, living on survival mode. It's a feeling and we know it will go away, but it's an addiction to living a life we don't love, preferring to do it all alone, smiling and smiling all along, singing to the wrong songs. But today, it is a new day, and we control our fate. Fight or flight affects our nervous system. Enormous energy and resources are placed on the wrong images and mindsets. Our organism perceives danger, alternating a rush of adrenaline. Fight or flight, my heart rate increases, my energy decreases, pupils dilate, salivary juices can't control my respiration. Time to fight, time to hide, unbalanced, seeking to regenerate. But today I continue to speak to the fighter in me, no longer in solitude, but living in gratitude. No need of fight or flight, just taking it a bit easy, truly receiving the joy in my life, my joy for existence, having appreciation, celebrating my kindness when I know we all can change the way we think. Fight or flight, I speak to my body, my environment, and I'm kind to my time. No need to get back to the familiar or the highly analytical, over-focused state, just changing the scenario. And I never realized my addiction to my state of fight or flight. I was addicted to a life I didn't even like. Whether it was a relationship, despicable relatives, that cutthroat co-worker, I was addicted to a life I didn't even like. I say rise, speak up, be brave, don't let no one ruin your day. No one ruin your life. It's your life. You change your fate. So this one's for the ones who've been on that mode of fight or flight, trying to remain alive, living on survival mode. It's a feeling and I know it'll go away. It's an addiction to living a life we don't love, preferring to do it all alone, smiling all along, singing to the wrong songs. But today is a new day. We control our fate. I'm Dr. Poetry, and you're not alone. Fight or flight. I am more than just an identity. I'm not just an idea, a concept, or an afterthought. I have to trust my soul. I'm trying to open up to be the individual within the collective, to be greater us, to be the greater us. And I know now I have an interest in the technology of my body. It's more than just an awakening. I realize it feels like I'm constantly seeking connectivity, understanding of self. I see myself transform through my ego, and it has helped me to survive. And I cannot allow it to control me. Allowing my heart to channel is flowing. It's a place where I can free the ego that's causing barricades in my solutions, my ability to execute these poetic expressions. I find my heart to be the place where my healing dismisses external power struggles, where my mind translates healthy emotions. I once thought they were lacking stability, truly fearful of inconsistency, enforcing the act and the application of my own discernment, intuition, maintaining an undeniable motivation, pouring into my higher self. Regardless of any disconnections of the fields of intelligence, it's when I tap into my infinite potential. In truth, it reaches all of my flow state, breaking free from man-made identities, when now I can connect to my authentic essence of who I truly am. I can receive guidance, feeling as though I'm in a trance, channeling, embodying my essence. It's been a while moving forward towards source, no longer ignoring contact connection through poetry. I am tapping into my many fields, attracting the synchronization that I manifested. And I read the time on the microwave, and it's 5:55, and I'm leveling up, changing for the better, keeping the momentum going. My desire to want to learn more and more, and now I read, it's 4:44 on my phone. Clarity, decisiveness, it's what I've been preparing for, finally coming into fruition, tapping into my intuition, applying my desire to answer to life. It's calling me to heal. I'm healing me, the being compassionate being. The being within me, while expanding and returning to harmony, truly celebrating the freeing of thyself from the egocentric identity while respecting my essence. Knock, knock, who's there? It's transcendence, and it feels like I'm that girl walking on fire. Rewire thoughts to nurture my expansion, loving on nature while loving on me. Loving me, loving that being in me. I am more than just a man-made identity. I'm healing. I'm honoring the being within me, desperately needing me. I am healing. Allowing my heart to channel. It's flowing. It's a place where I can free the ego that's causing barricades in my solutions and my ability to execute these poetic expressions. I'm not just an idea, a concept, or an afterthought. I'm healing. I'm Dr. Poetry.
I'm healing. I'm healing. We have to heal. And poetry helps us cope with this. There's a lot of people who are dealing with fibromyalgia. You don't necessarily need to be a police officer, but because this is Floetic Justice behind the uniform, and I'm Dr. Poetry, I love to share things that are supposed to make you feel awful, yet you are coping and you're still giving your best face to embrace life. You got to keep going. I'm here for that. If you would love to be on the show, you can reach us at www.hearmeoutpoetry.com. You can give us a call at 787-401-9965. You could even email us at hearmeoutpoetry7@gmail.com. We're here for you. You know, you can share your experiences, especially if you are in the law enforcement field. If you wear a uniform such as military personnel, you know, you're out there, you're serving this country, or you don't have to be in this country. You could be in another country, international. We want to hear your stories and how you deal with these type of things. Not only fibromyalgia, you may be suffering from something else. Today, we're talking about fibromyalgia. We appreciate each and every one of you and those suffering with fibromyalgia, wearing the uniform and having that resilience to come back to work, to continue your shift, working under those stressful situations. When we all went to the academy, we didn't plan on getting that. This one is for all of those females out there who are policewomen, who serve the military, paramedics, firewomen, right? It is tough, but we make it. I know I work with a lot of great officers, and I don't know too many who have come forward to say they have fibromyalgia. They're probably out there, but it is May. It is the month of May, fibromyalgia awareness. And if you didn't know about this before, I strongly encourage you to look into it, because fibromyalgia presents a significant health challenge for policewomen. A group exposed to high physical demands, psychological stress, and irregular work patterns. The chronic pain, fatigue, and cognitive impairments associated with fibromyalgia can profoundly affect their job. It affects my job sometimes. It affects the job performance, quality of life, and at times your mental health, because you're concerned with so many things. And due to the nature of law enforcement duties, right? Early diagnosis, workplace accommodations, and comprehensive multidisciplinary management are essential to support affected officers. Increased awareness, tailored medical care, and institutional support are crucial in ensuring these patients can maintain both their health and professional responsibilities effectively. It's not just a responsibility, but you want to make sure it's effective, it's diligent. Fibromyalgia is a chronic pain disorder that's characterized by widespread musculoskeletal pain. I get it right here, I get it all here, and I wear a bulletproof vest and I keep going to work. But then you get this fatigue, sleep disturbances, right? And cognitive difficulties. Like sometimes I get this fog, and I call it the fibro fog, the foggy, gloomy gray, right? It's known as fibro fog, but I call it the fogginess, right? In policewomen like me, this condition, all right, it's going to pose a unique challenge due to the physical demanding and psychologically stressful nature of law enforcement. I've been saying that all day, right? But policewomen, we often engage in physically strenuous activities, irregular shift work, and high stress encounters. But the symptoms, they tend to lead to decreased job performance, increased absenteeism. Like, I am constantly absent. Sometimes I go back to work. I don't like to say so, but that's the situation, right? We know that fibromyalgia is frequently underdiagnosed or misdiagnosed, particularly in high-stress professions where symptoms may be attributed to burnout or overwork. The first thing they're going to tell you is like, you've been working a lot. Addressing fibromyalgia in policewomen requires a proactive, compassionate, and informed approach. With proper recognition, medical care, and institutional support, policewomen with fibromyalgia can continue to serve effectively while managing their health. I intend to. Prioritizing our well-being ultimately strengthens the integrity and resilience of the law enforcement community. I'm Dr. Poetry. This is Floetic Justice Behind the Uniform with Deaf Poetry and Dr. Poetry. We appreciate you. And I just want to say that you can give us a call anytime you need. You want to talk to us? You can give us a call. We're here. And a big love and hug to all those first responders out there. We appreciate your work and your serving our country. We appreciate your service. Thank you for your service. And get some help if you need it. I'm Dr. Poetry. Have a good one.
Underneath the police uniform, I'm just like you. A lover, of laughter were dreams that grew. In every smile I share, a story unfolds. A reminder that compassion, it never grows old. Behind the badge, my heart beats the same. A melody of empathy, compassion, and fame. With every act of kindness, I'm trying to be that change. Using my voice to break through the range. Underneath this uniform, I'm a human being with feelings and emotions. A story worth seeing through the triumphs and struggles. Spreading love, hope, and the power of love. But a soul with a purpose, seeking no fame. Underneath this police uniform, I am real. I'm a woman of strength with love. Nothing to keep behind in a secret. Just love to reveal. Because underneath this police uniform, I am human. A woman, not the norm. I may wear satin and lace and pearls underneath, but here to heal. Break the world's swirls. I fight the darkness to protect the weak. And in the line of duty, my compassion, it doesn't just peak, it lives and bleeds through the chaos. I find my grace. I think of being a warrior with love in every chase. The beneath part of being a police officer is that behind the badge, a heart beats strong, and I'm ready to mend what's been torn for so long, because with kindness as my weapon, I'll prevail. In the name of justice, I will lift the veils. I am love. I am truth, peace, freedom, and justice. As I repay my karmic debt, it shall be fulfilled, because I am the change. And my only aim is to heal and not kill. I wanna heal and not kill. You see, I have a hard time explaining things sometimes, because most people don't see that power is an intoxication of the indoctrination, causing frustration from all the emotional suffocation. And that's why my beloved is constantly telling me, you must stay balanced and stay centered. Because every tear I wipe, every soul I save in this uniform, I don't want to be a hero engraved in a tombstone. I am human with kindness as my weapon. I keep saying, I am human underneath this police uniform.